This brief presentation will give you an overview of the Irish healthcare system. My name is Dr. Niamh Murphy from Waterford Institute of Technology in Ireland. This collaborative look at the healthcare systems of Ireland and the US is part of the Teach CoLab project, an initiative which has begun to join students and staff at the University of Washington, Bothell and Waterford Institute of Technology. The size of Ireland is roughly equivalent to the size of Washington State. But in the whole of the Republic of Ireland, there are 4.8 million people compared to 7.4 million in the state of Washington. In Ireland, the Department of Health's main role is to support the Minister and Ministers of State in the development and implementation of policy for the health services. It also monitors the performance of health services, and health services are then delivered by the Health Service Executive, or HSE. The current Minister for Health is Simon Harris. This, however, could all change in just over a week's time as Ireland faces into its next general election. All persons resident in Ireland are entitled to receive healthcare through the public healthcare system, which is managed by the HSE and funded by general taxation and subsidised fees for service. All maternity services and all childcare up to the age of 6 months are provided free of charge. While the Irish healthcare system is primarily a tax-financed public system, most people pay for primary care out of their own pocket. In addition, 45% of the population pay for supplementary health insurance, which allows them access to private hospital cover. All maternity services and childcare up to the age of 6 months are provided free of charge. Currently, about 30% of the Irish population have a medical card that covers them for all health services, and then you pay for certain services after that. So, for example, a visit to a GP costs around about €55 or $60. Ireland is unusual in the degree of overlap between the public and private healthcare systems. So, for example, the treatment of public patients in private settings has taken place under the National Treatment Purchase Fund. So, if you have a hip operation, for example, and you've been waiting for a certain period of time, then you can be treated in a private hospital, even if you are a public patient. There's cross-party support in government for reforming this two-tier system of private versus public funding for the healthcare system. And the government is committed to achieving the idea of universal single-tier public health, and this is called Sláinte Care. So how does Ireland compare to the rest of the world? Well, Ireland's expenditure in healthcare as a share of GDP is considered in line with the European average of around about 10%. However, it must be noted that Ireland spent substantially less than its EU neighbours on healthcare over the past couple of decades. And in Germany and the Netherlands, they spent about 54% more than Ireland did annually on a per capita basis in the 1980s and the 1990s. This historical lack of investment means that now the hospital system is creaking at the edges. There are constant problems with lack of number of beds, lack of doctors, and this is very much in the news here in Ireland at the moment. There's a realisation now in Ireland that this big healthcare problem can only be tackled if all government parties come together. And this new plan, Sláinte Care, has a 10-year lifespan, and the plan is to spend an additional €2.8 billion per annum in order to tackle this two-tier health system. Another noteworthy initiative in Ireland is the Healthy Ireland strategy, and this is a cross-departmental strategy to try and improve the health of everybody living in Ireland. There is a lifestyle component to this, and the little video in the following slide will give you an idea of this, but more importantly, it aims to tackle the social determinants of health and make sure that everybody in Ireland can enjoy the benefits of a better life.
Mrs. Joe. Hello. And Joe's couch. Hello. They were seeing just a little bit too much of each other until Joe decided to get healthier. But Joe didn't know where to start until Joe's friend, Flo, introduced him to Healthy Ireland, the place to go to get in the know about mental well-being, healthy eating and being more active. Just ask Joe and Flo and Co. Get in the know like Joe. Search Healthy Ireland from the government of Ireland.
As a nation, we are living longer. In the 1960s, the average Irish man could expect to live to about 68 years. Now he should be around to celebrate his 75th birthday. And women fare much better with a life expectancy of 72 years in the 1960s, which has now risen to over 80 years. And for the first time, our average life expectancy is above that of the EU average. And this has been a rapid increase unmatched by any other EU country since 1999. Over 80% of Irish men and women rate their health as good or very good. This does not mean, however, that there aren't significant mental health issues in Ireland. Many advocates, many groups are working very, very hard to tackle this, and funding for mental health services increased last year and is likely to continue to increase into the future. Thankfully, suicide rates in Ireland continue to fall after a rise between 2008 and 2012. Now, these suicide rates have fallen below the EU average for the first time since 2010. In some areas of public health in Ireland, considerable strides have been made, particularly in cancer policy, mental health policy, physical activity policy. One area which hasn't fared so well, however, is in alcohol policy. And an alcohol bill which was passed in December 2015 still has not been fully implemented, particularly around minimum pricing of alcohol. A common measure of income inequality is the Gini coefficient. This produces a single number from 0 to 1, which represents the overall level of income inequality in a country. The higher a number is to 1, the greater the level of inequality. The US is one of the most unequal countries in the world, but Ireland isn't far behind. And TASC, which is an independent think tank, says that we should be worried about these long-term trends in Ireland. And so, to finish, it's good to remind ourselves that if we are interested in creating healthier nations, then what we need to do is to create equal societies. Wilkinson and Pickett, in these two wonderful books, contend that people in more equal societies live longer, have better mental health, and are more socially mobile. And this is why, at the end of the day, equality is good for everyone. Thank you for listening.